Hi everyone, I'm Beatrice. In this video, we'll look at sickle cell anemia. So we'll look at what it is, the pathophysiology, the risk factors. We'll look at the signs and symptoms, how to diagnose this disease, including some lab investigation. We'll look at the management, nursing intervention, and even patient teaching. So if you are ready for today's video, let's begin. Sickle cell anemia is a genetic blood disorder, or we'll say it's a genetic hemoglobin disorder, where the normal hemoglobin, which is hemoglobin A, is replaced with abnormal hemoglobin known as hemoglobin S. So under stressful condition, or maybe there's low oxygen like in high altitude, or in illness or infection, or there's change in temperature like extremely cold weather or extremely hot weather, or even in dehydration, this defect in the hemoglobin make the red blood cell very stiff, rigid, and becomes very sticky. Also, this red blood cell will adapt the shape of a crescent, the shape of a sickle, instead of the round, nice, smooth, flexible, normal hemoglobin A. Now, there are some terms that applies to sickle cell disease or sickle cell anemia that I want you to note. One of them, you may hear things like, this disease is a homozygous disease, is an autosomal recessive disorder. So when you hear homozygous disease or recessive disorder, we're saying that the individual must inherit 2 sickle cell genes, one from each parent, to have the disease. Then when you hear autosomal recessive disorder, that autosomal is talking about the gene involved is located on one of the 22 pairs of autosomes. We know that we have 22 pairs of autosomes and 1 pair of sex chromosomes. So meaning it's located on one of those 22 pairs of autosomes. So in other words, it's not sex linked. That means individuals are affected equally in terms of sex, both male and female. It's not a sex linked disease. And then you hear terms like, oh, this person is a sickle cell carrier. So what they mean is that the person have a trait of the sickle cell disease, but is not homozygous enough to make the person have the disease. So meaning the person have both the normal and the abnormal hemoglobin present on the red blood cell. So making the person have the gene and the trait of sickle cell disease. But these ones, they will not manifest the signs and symptoms. And then we hear terms like this, a normocytic hemolytic anemia. So normocytic meaning the mean corpuscular volume, the size of the red blood cell is normal, is within 80 to 100 femtoliters. And then you will hear hemolytic, that means there's excessive breakdown of the red blood cells. And that's because of that abnormality in the shape of the red blood cells. Normally the lifespan of red blood cells is between 90 to 120 days. But for sickle cell disease, where the red blood cell is abnormally shaped, the shape of an S, it easily breaks down. The spleen breaks it down within 10 to 20 days, is broken down. So there's excessive breakdown of these red blood cells. And because the bone marrow cannot keep up with continuous production of the red blood cells, the patient becomes anemic. That's why you hear the name or see the name sickle cell anemia. Let me analyze what I mean by the disease is homozygous or is a recessive disorder with this illustration. So if this is a father, and this is a mother, the father is AS, so meaning the father is a carrier, the mother is a carrier. For the child to have sickle cell disease, the percent is 25. So there's one chance, if they produce 4 kids, there's one possibility of having a child with sickle cell disease. Also, there's a 50% chance of 2 children having the traits of sickle cell disease and 1 chance of having a child with the normal hemoglobin AA. So the first thing is that the father releases this gene, the mother releases this gene to have a healthy hemoglobin and genotype AA. The father also releases the A gene, the mother releases the S gene. So what they are going to have is AS. The father releases the S gene, the mother releases the A gene. They're going to have another AS. Now, if the father releases the S gene and the mother releases the S gene, what they are going to have is the SS. So this is the homozygous disease, where this is where the problem is. So it has to be homozygous, it has to be recessive for this person to have the disease. So this is sickle cell. For these two, there's a 50% chance. So these are called the carriers. These two are carriers. So we call them sickle cell carriers. And this is the normal hemoglobin, the AA. So this one is normal. No trait of sickle cell in the gene. Another thing you need to know about sickle cell disease is that for the first 6 months of life, the baby will not show signs and symptoms of sickle cell disease. The reason is because of that fetal hemoglobin. So it protects them for that first 6 months. But after 6 months, the fetal hemoglobin decreases and that hemoglobin S take over. And then the baby will begin to show that signs and symptoms of the disease. For the risk factor for developing this disease is basically family history. So if you are from African descent, there's the highest risk factor. Then we have the Asia, the Middle East, the Indians, the Caribbeans, and at times the Latin Americans. So it's just family related, it's genetic. Let's look at the signs and symptoms of sickle cell anemia. From the word anemia attached to sickle cell, so they are going to manifest anemia symptoms like dizziness, shortness of breath, pallor, fatigue. So you see some of those signs and symptoms. Another thing is pain. Pain is a big one, especially during crisis. Then another sign and symptoms is dactylitis. So dactylitis has to do with swelling around the hands, around the feet, like the extremities, especially in children and in infants. And then we have infection. People with sickle cell disease, they are prone to infection because of the overworking of the spleen. The spleen is also supposed to play a role in immune function. But when the spleen is overworked, it's not able to play that role effectively. And then jaundice, because of excessive breakdown of red blood cells, the heme that is converted to bilirubin, it becomes so overwhelming for the liver to clear off. And then they begin to circulate. So you see that yellowish discoloration around the skin, the mucous membranes, the eyes, and all that. And then, of course, gallstones, because of that excessive bilirubin that is circulating, it can begin to form gallstones. Now, let's quickly look at sickle cell crisis. So by sickle cell crisis, we mean acute episode of symptoms. There are different crises the patient may experience. In condition that is not palatable, like in dehydration, in low oxygen, in extreme weather condition, under stress or infection, the patient may manifest some crisis. Now, one of them is vaso-occlusive crisis. So that means there's an occlusion in blood vessels. So those red blood cells that are sickled, that are abnormally shaped, they become sticky and can block blood flow. That can cause organ problem, infarct, death. It can cause ischemia, it can cause ulcer. Because if blood is not able to flow to a particular organ, it can cause organ damage, it can cause ischemia, decreased blood supply to the organ, it can cause death, it can cause a lot of problems. Another one is splenic sequestration crisis. So you remember that the spleen helps to recycle blood. It helps to remove old blood, abnormal red blood cells, and also store blood so that when the body needs it, it releases it. But in a situation where the red blood cells are sickled, when they go into the spleen, they are not able to exit. So with time, the blood keep entering the spleen but is not able to exit. It can cause a pool of blood in the spleen. This can lead to shock. It's very dangerous because those blood vessels in the spleen are very small. When they block it, blood is not able to exit. That's very dangerous. It can lead to hypovolemic shock, meaning there is blood in the body, but it's just there pooled in the spleen. It's not getting to the circulation. There's also a aplastic crisis. So in this one, there is total failure in the bone marrow in producing red blood cells. And then we can have hemolytic crisis where there's extreme or excessive breakdown of the red blood cell. It can cause crisis. There will be severe symptoms. Now for testing, lab investigation and diagnosing sickle cell disease, we have decreased hematocrit, increased reticulocyte. Reticulocyte are immature red blood cells. And then we have increased white blood cell because of problem with the spleen. And then increased bilirubin because of excessive breakdown of red blood cells. Then one of the diagnostic methods is hemoglobin electrophoresis. And then we have newborn screening. So a baby that just born can be screened for sickle cell gene. And also, even while in the womb, in utero screening, they can test the amniotic fluid or test some placental tissue for sickle cell gene. Now, treatment and management of sickle cell disease, pain is a big one because of those crises. You have to give pain medication, opioids in particular, round the clock. Then we have oxygen therapy. If they are short of breath or they are not saturating well, you can give oxygen as prescribed. And then hydration. Hydration is very important. When you give enough fluid, it makes those blood lighter, and then that sickle shape, they begin to straighten out and prevent occlusion. And then antibiotics. If there's infection, you can give prescribed antibiotics. Vital sign, very important. You have to monitor the vital sign, you monitor the respiration temperature, the oxygen saturation. Just monitor the vital sign generally. And then blood transfusion can be done, especially when the blood level is very low, the hematocrit is very low. Depending on how severe the anemia is, the patient can be transfused. And then we have hydroxyurea. So this medication is given to increase fetal hemoglobin, the circulating fetal hemoglobin, and also to reduce complications like vaso-occlusive crisis. Then teaching, you have to teach the patient the importance of hydration, to drink a lot of fluid, avoid sick people, be up to date with immunization. You also need to teach them to avoid crowd and avoid any extreme weather condition, avoid stress as much as possible, avoid infection. So that wraps us today's topic on sickle cell anemia. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.